In today's video, we will explain the disease atherosclerosis. Atherosclerosis is defined as the buildup of fats, cholesterol, and other substances into the walls of arteries. Almost all children older than age 10 in developed countries have aortic fatty streaks, which are followed by coronary fatty streaks in adolescence. It is a leading cause of death worldwide. It is unknown what exactly causes atherosclerosis. It is thought to be a multifactorial disease. Atherosclerosis can stay asymptomatic for decades. It takes time for the disease to have an effect on blood flow. Symptoms begin to appear when sufficient narrowing or closure of an artery due to clots occurs. Chest pain, shortness of breath, sweating, dizziness, or palpitations are common symptoms of atherosclerosis. Several factors are known to increase the risk of developing atherosclerosis. They include hypercholesterolemia, hypertension, diabetes mellitus, smoking, and family history. Atherosclerosis develops through the continuous process of fat buildup into the arterial wall, causing chronic inflammation. These fats evolve into fibrous plaques that are susceptible to rupture. Diagnosis of atherosclerosis is based on laboratory tests that check lipid levels in the blood, clinical symptoms, and imaging. Angiography, or visualization of blood vessels, is considered the primary method for imaging lesions. However, since it is an invasive procedure, it's not always recommended. An alternative approach is the use of computed tomography to visualize the blood vessels, done by performing a non-invasive method. The management of atherosclerosis is aimed at reducing cholesterol, blood pressure, or clotting. This is achieved by medications such as statins, that reduce the ability of our bodies to produce cholesterol, calcium channel blockers, that decrease the smooth muscle tone, and aspirin that prevents the aggregation of platelets. Surgery is another approach to treat atherosclerosis. When the disease has become severe, causing tissue loss, a surgical procedure may be indicated to re-establish blood flow with stent placement. Atherosclerosis can progress into dangerous complications such as coronary artery disease, cerebrovascular disease, transient ischemic attack, and abdominal aneurysms. The prognosis of atherosclerosis is quite good nowadays, given the advances in the management of risk factors and better diagnostic methods that detect the disease in earlier onset. Controlling lipid levels, adhering to a balanced diet, quitting smoking, and regular exercise all contribute to preventing cardiovascular disease and increasing quality of life simultaneously. To summarize, atherosclerosis is a multifactorial disease that is developed by a buildup of fats into arterial walls. It can stay asymptomatic for decades before chest pain, dizziness, and palpitations become apparent. It is diagnosed by laboratory tests, clinical symptoms, and imaging techniques. Proper diet, regular exercise, and control of lipid levels can all help prevent atherosclerosis and its complications.